Hi. In this very important video, I want to discuss how whole food plant-based eating can help you during your pregnancy and when you raise your children. Now, a common question might be, is it safe to eat this way during these stages of life? And the answer is a resounding yes. Eating a whole food plant-based diet is safe through all stages of life and protective through all stages of life. So some of the common complications that occur during pregnancy are preeclampsia, gestational diabetes, and macrosomia. Eating a whole food plant-based diet can prevent all of these conditions and can help to reduce these complications if you do happen to suffer from them during your pregnancy. But there are some special things we need to consider. If you live in an area where you do not have access to proper nutrition, then it's really important to take a prenatal vitamin. But if you live in an area where you have easy access to fresh fruits, vegetables, grains, legumes, and a variety of these foods, then it may not be necessary to take a prenatal vitamin. If you are mindful and making sure you're taking your B12 and making sure you're eating foods that are rich in folic acid like beans, veggies, and greens, then you probably don't need to supplement. Also, a lot of women struggle with anemia during pregnancy, and making sure, again, getting those greens and beans and sweet potatoes in will help keep your iron levels at the ideal stage while you're pregnant. Making sure you're getting enough sunshine to get your vitamin D, and supplementing with like those little light lamps, vitamin D lamps, or even a vitamin D supplement if you are pregnant in the winter and are able to get access to sunshine every day. Keep in mind that people who take a supplement of iron, doctors have found that it can actually be harmful to your microbiome. So getting your iron from food sources is far superior than taking a supplement. So let's talk after babies are born. I was fascinated to learn all the ways that breast milk is just the best thing ever for our babies, and that even after the age of 1, 2, 3, lots of people breastfeed, clear into these later stages, and a lot of children can digest the lactose in breast milk until between the ages of 2.5 and 5, and then they kind of lose that ability. So as long as you are enjoying breastfeeding and your child is enjoying breastfeeding, then go for it, even past 1 year, but 1 year minimum. If you're not able to breastfeed because of your work situation or your life situation, there are other options for you. So you can get donated breast milk from a breast milk bank, or you can use organic, non-GMO soy formula. That's far superior to dairy-based formulas. And the reason for that is the casein protein in dairy is actually really, really inflammatory and can cause a lot of digestive issues for babies. So stay clear of the dairy and seek out soy formulas. If you have a baby who is born prematurely, getting donated breast milk and talking to your doctor about some other options will be the best way to go for you. So after your baby is done breastfeeding, you can actually just go straight to water. You can certainly let them have, almond milk and soy milk if you so choose, but it's not necessary. Doctors do recommend that you avoid rice milk though, because there are trace amounts of arsenic in rice milk. So when your baby is ready to be introduced to solids, well, obviously mashed up solid foods, between the ages of 4 and 7 months is when your baby is open to all flavors and textures, even leafy greens and crucifers, which can kind of have a bitter texture or a bitter flavor. They're open to them at this age. So be sure to give them a wide variety of these foods. And I'll provide a link to this really awesome little baby feeder I love to use for my babies, where I could kind of put some whole foods in there and just let them gnaw on it and didn't need to worry about them choking. Doctors are also recommending introducing your babies to nut butters at this stage. They used to recommend waiting, but they're finding that kids who wait actually have a greater risk of developing allergies. So between ages of 4 and 7 months, if your doctor says it's okay and you don't have obviously a history of allergies in your family, then introducing nut butters is safe. One of the most important reasons for introducing whole plant-based foods to our kids at this age and then continuing the habit is that kids who eat a whole food plant-based diet tend to go through puberty later than kids who don't. They go through puberty in a more natural, normal state. Kids who eat a mostly westernized diet actually start their periods sooner and go through puberty earlier. That just means they have more hormones circulating through their bodies from a younger age that puts them at risk of developing cancers that are hormone dependent later in life. So whole food plant-based diet actually can protect our kids and help them have a more natural, healthy path through puberty. So researchers have found that when they did the blood work of 10-year-olds, every single kid they tested had fatty streaks already built up in their blood vessels. And by the time our kids reach their 20s, 77% of them will have fully formed plaques, with 90% of them having occlusion in their vessels, meaning their blood vessels, some of their blood vessels are so blocked, they're 90% blocked, that very little blood flow is getting through. So obviously, if you can feed your children a whole food plant-based diet, they're going to be protected from developing those fatty streaks in their vessels, and they're going to have heart health throughout their lives instead of dealing with our number one killer in America, which is heart disease. So foods to focus on after your child is finished weaned until the age of about 3, you really need to make sure that they're getting enough fat in their diet, because breast milk is really full of fat, and that aids in brain development. And so continuing that trend through the age of 3 when they're still going through such a rapid growth stage is really important. So making sure you're feeding your child avocados and nut butters throughout the week to make sure they're getting the fat they need. And then ages 4 through 18, their fat needs go down a little bit, and you can just focus on making sure they're getting a good variety of nuts and seeds and avocados. Beans and dried fruit are also really great for developing bodies. And if your child is an athlete, make sure that they're getting the nutrition that they need. Beans and lentils are really great for muscle repair and just overall repair from when you've worked out really hard. Kids who eat a whole food plant-based diet have reduced risk of asthma, allergies, have far fewer infections, fewer incidents of ADHD, and skin conditions like eczema. So it really is protective for our kids. And I know it is common to hear that we need to avoid soy because of the estrogens in them, but the opposite is actually true. Soy foods are protective for girls and for boys. They protect against prostate cancer, breast cancer, and other hormonal cancers, and they help our girls start their periods at a healthier time in their lives and have a far better hormonal balance throughout their lives. So soy really is the best. Dairy is our harmful source of getting exposure to excess hormones in our diet. So I have linked in the Dig Deeper section to the websites of 2 plant-based doctors, an OBGYN and a pediatrician, and please go over to their websites to get any additional information and insights you may be interested in helping your family either implement a whole food plant-based diet or beginning from the start, helping your kids have a long and healthy life through plant-based eating.